The main goals of drug development are effectiveness, efficacy, and safety. Because all drugs can harm as well as help, safety is relative. The difference between the usual effective dose and the dose that produces severe or life-threatening side effects is called the margin of safety. The wider the margin of safety, the more useful the drug. If a drug's usual effective dose is also toxic, doctors do not use the drug unless the situation is serious and there is no safer alternative. The most useful drugs are effective and for the most part safe. Penicillin is such a drug. Except for people who are allergic to it, penicillin is virtually non-toxic, even in large doses. On the other hand, barbiturates, which were once commonly used as sleep aids, can interfere with breathing, lower blood pressure, and even cause death if they are taken in excess. Newer sleep aids, such as temazepam and zolpidem, have a wider range of safety than barbiturates do. Designing effective drugs with a wide range of safety and few side effects cannot always be achieved. Consequently, some drugs must be used even though they have a very narrow margin of safety. For example, warfarin, which is taken to prevent blood clotting, can cause bleeding, but it is used when the need is so great that the risk must be tolerated. People who take warfarin need frequent checkups to see whether the drug is causing the blood to clot too much, too little, or appropriately. Clozapine is another example. This drug often helps people with schizophrenia when all other drugs have proved ineffective. But clozapine has a serious side effect. It can decrease the production of white blood cells, which are needed to protect against infection. Because of this risk, people who take clozapine must have their blood tested frequently as long as they take the drug. To help ensure that their treatment plan is as safe and effective as possible, people should keep their healthcare practitioners well informed about their medical history, drugs, including over-the-counter drugs, and dietary supplements, including medicinal herbs, that they are currently taking, and any other relevant health information. In addition, they should not hesitate to ask a doctor, nurse, or pharmacist to explain the goals of treatment, the types of side effects and other problems that may develop, and the extent to which they can participate in the treatment plan. Drug administration is the giving of a drug by one of several means or routes. Drug kinetics or pharmacokinetics involves what the body does to a drug, including the processes of absorption, distribution, metabolism, and elimination, and how long these processes take. Drug treatment requires getting a drug to its target site or sites, specific sites in tissues where the drug performs its action. Typically, the drug is introduced, the process of administration, into the body far from this site. The drug must move into the bloodstream, the process of absorption, and be transported to the target sites where the drug is needed, the process of distribution. Some drugs are chemically altered, the process of metabolism, by the body before they perform their action. Others are metabolized afterward, and still others are not metabolized at all. The final step is the removal of the drug and its metabolites from the body, the process of elimination. Many factors, including a person's age and genetic makeup, can influence these processes. Drugs are introduced into the body by several routes. They may be taken by mouth, that is, orally, given by injection into a vein, that is, intravenously, into a muscle, intramuscularly, into the space around the spinal cord, intrathecally, or perhaps beneath the skin, subcutaneously, placed under the tongue, sublingually, inserted in the rectum, rectally, or vagina, vaginally, instilled in the eye by the ocular root, sprayed into the nose and absorbed through the nasal membranes, nasally breathed into the lungs, usually through the mouth by inhalation, not exhalation, applied to the skin cutaneously for a local, topical, or body-wide systemic effect, or delivered through the skin by a patch transdermally for a systemic effect. Each route has specific purposes, advantages, and disadvantages. The oral route, because the oral route is the most convenient and usually the safest and least expensive, it is the one most often used. However, it has limitations because of the way a drug typically moves through the digestive tract. For drugs administered orally, absorption may begin in the mouth and stomach, but usually most of the drug is absorbed from the small intestine. How's that? 135.
It's tough.
Huh?
That was tough.
Yeah. It's tough.
Well, let's go eat. Transdermally?
Yeah. One word.
Should I have trans in my dictionary?
You should
As
have it in your
trans.
dictionary with a hyphen and a delete
backspace.
space.
Okay, I wasn't sure.
Now let's the dictionary. Well, anyway, most of the time it's hyphen.
I mean, yeah, usually. Alright.
But if you had something like transit, that would be in your dictionary as one word.
Right, so, yeah,
So
that's
you don't have to
fine.
worry about it.
Transdermally, though, is one
Well,
word.
transdermally is hyphenated.
It's hyphenated?
Yeah. I think it was hyphenated. Let's see. I have the dictionaries in my other room. Let's see. So there's probably some good reason. He's probably sick or something. What did he tell you? That he would come?
Yeah,
When did you call him?
yesterday.
You know, yesterday, sitting next to